It's a great transition over to Supervisor Andersen talking about vaccine distribution. And I have to say, Supervisor Andersen, I have relatives in many counties throughout the Bay Area and in Contra Costa County. All of my relatives who are either in the early phases or above a certain age have already been vaccinated. And I can't really say the same for other counties. So it seems like Contra Costa is at the leading they're leading the charge in terms of getting the vaccines out to the residents. So thank you very much. It seems like everything is going great, and look forward to your update.
Okay, well, and I'm going to share my screen if that's all right. I want to just sort of walk you through initially a little bit of where we are and then go right into the vaccination, because that really is what is so critical to all of us. Is when will we get vaccinated? So starting out, I am just going to talk about the fact that, as Ann mentioned as well, we hope we're at the tail end of a surge, but we still are in a surge. And as of yesterday, we did have 288 people hospitalized. In context, November 1st, we had 36 people hospitalized. And you can see from this graph how significant we've been in December, almost a plateau, but a continual surge. In talking to our health officers this week, they did a presentation before the Board of Supervisors. They thought it was still likely that next week we might get up to 300 people hospitalized, but then we're very hopeful that we are at the end of this surge and we're going to start seeing numbers going down. For me, ICU beds occupied has always been a significant issue, because we never wanted to be at that point where we could help people, but we were so overwhelmed we did not have that ability to do so. And that goes back to March, when we were seeing pictures of New York, of Italy, where hospitals were so overwhelmed. So currently in Contra Costa County, 151 of our beds are occupied. Now, this is not all COVID patients, it's all ICU patients. We do have 14 beds available. And then you look at the county and you look at it in the context of the Bay Area, because as you all know, we're in a significant shelter in place order because our ICU capacity in the San Francisco Bay Area has been below 15%. And so as of yesterday, our ICU capacity in our county was 2.3%. ICU capacity Bay Area wide was 3.4%. So to get out from under the state's shelter in place order, which is the one where, even though we're in purple tier, we don't have outdoor dining open, we don't have hair salons, nail salons, other personal services open, we have to get not exactly to the 15% ICU capacity, but using the state's model. They need to be able to project that 4 weeks from now, from the date of their modeling, we will be at 15% capacity, at which time they will lift the shelter in place order, which will allow us to go with our regular purple tier categories. And just a quick, again, looking at where we are currently, as of yesterday, 55% of all of the tests we're having 55 people per 100,000 testing positive, 10.3% testing positive, and then 15.7% of our equity adjustment. And those are people in disadvantaged communities where we have seen from the day one an unusually higher proportion number of positive cases. And this is primarily because they can't work from home. They don't have that luxury. They oftentimes might have multiple families living in much closer quarters. They don't have the ability to just quarantine when one person gets sick, even though we do have facilities to allow for that, but there's some hesitancy there. And so when I was last here, just to put it in context, which was the first week of December with Mayor Clarkson's final date, we were at 37.7 per 100,000, and we had an adjusted rate of 28 people, per 100,000. And our positivity rate in early December was much lower, 7.5%, with the equity metric about just under 12%. And so again, this is all the tiers we're in. We've got to get below 7 per 100,000 to, or that's where more than 7 per 100,000 is where we are in purple, but we've got to get below that 7 to move down to the red tier. So cases by city, San Ramon, you've seen 257 cases in the last 14 days. So it's still very, very rampant in your community. And as we all know, some people, might lose their sense of smell and have no other symptom, or maybe entirely asymptomatic. Other people may end up in the hospital. So that's why I think Anne's final comments about don't let up your guard, continue to do what we know we need to do, which is the masking, 6 feet apart, staying home as much as possible, and particularly if you have any symptoms, are so, so important. Deaths. San Ramon, you've lost 12 residents. 5 of those were in long-term care facilities, but it's still a significant number to lose 12 of your own community because of this pandemic. And on the county's website, you can see by location how many people have passed away. Danville has lost 17 people in this last 9 months that we've been in the pandemic. 478 in total in Contra Costa County. Nearly a third of those deaths were in the month of December, when we really saw the numbers climb. That was 146 in December. Schools reopening, I won't jump into this other than to say the governor has come up with a new plan to try to get our schools reopened, but we cannot really even look at that in our county till we drop below 25 cases per 100,000. And then you've got some very robust guidelines that need to be followed before you can. Until we get in the red tier, once again, plans will have to be proposed that would go to the county health, to the state health, and the county office of education. County office of education has some great information. I was on a panel with Lynn Mackey, our county's superintendent of schools. I would recommend going there if you've got a question about schools. And I do want to express my thanks to the San Ramon Valley Unified School District Board. They have been working tirelessly. Everyone's goal is to get our kids back in school as soon as we possibly can and as soon as we safely can. So let's talk about vaccines. Now today, in about 45 minutes, there's going to be a press conference where they're going to be launching. We are shooting for 1 million vaccines by the 4th of July. And that is a very robust, exciting goal. To get there, we would really like to have the goal of 9,000 vaccines per day. And again, we're getting very close to having the infrastructure there, where we've got the partners in place to administer the vaccines. As Anne was mentioning, at San Ramon Regional, they're ready to vaccinate. Shout out to San Ramon Valley Fire Chief Paige Meyer and his entire group, who have been doing a lot of our vaccinations of the first responders, of those who are eligible in the first tier 1A and then tier 1B. And so go to our dashboard. As Anne mentioned, it's updated regularly throughout the day, and will give you a really clear picture of where we are in our county. To date, this was really as of yesterday when I captured this screenshot, we have administered over 57,000 vaccines, 47,000 plus were their first dose, just under 10,000 second dose. And so right now, 5% of our county population, 16 and older, have been vaccinated, and 1% have received their second dose. And so this is a good thing. Obviously, as we're looking at community spread, the more people who are vaccinated, the less chance of that being spread. There is a very clear timeline, and the timeline is really following the CDC, the Center for Disease Control's timeline, along with state guidelines. And then within the county, we have a committee that is made up of healthcare professionals and others that come up with sort of the ethical distribution, which really to date has just mirrored what is allowed by the state. And so as you can see from this timeline, phase 1A has been our healthcare workers, and our employees and residents of long-term care facilities. And we've had great partnerships, particularly with some of our local pharmacies and chain drugstores, of going into our larger long-term care facilities, administering these doses, great partnerships with our healthcare partners in making sure this happens as well. And right now we're in the phase where we are working with some of the smaller, under 35 homes, skilled nursing facilities, and we are actually moving into the even smaller, 6-person or less congregate care facilities. Again, it's with our partnerships, fire, with our healthcare providers, who are really making sure that this very, very vulnerable population, particularly when they're in a congregate care setting, even as small as 6 people, are getting the vaccine, because as you've all seen from day one, that's who we're losing primarily. It is the people who are over 75 who are dying at a much higher rate, and particularly if they are in a congregate care setting. So phase 1B did start, and that's people ages 75 or over. And also the state did throw in 65 to 74 years old. And again, it's based on the science of who's really being affected by it, who's having the most extreme impact when they get the virus, and who's succumbing to the virus. And so this is what really started in January, launched it, and I'll get into the whole appointment process, but we have been very successful in just filling people in. And while people who are 65 and older are allowed to also request appointments through the county's website, we continue to prioritize 75 and older. We want to make sure that they get their vaccine first. 65 and older are filled in where spaces are available. And so sometimes people who put in a request for a vaccine may not hear back right away because we haven't found the right spot for them. And right now, we're really grateful that our healthcare providers are jumping on board, and they are now lots of great messaging. And I happen to receive my medical care through John Muir, and I appreciate that. Just even this morning, got another important notice just saying, this is when your turn is. I'm 60 years old, so I don't qualify yet. At some point, I will be vaccinated, I'm sure, but it was really helpful. My 90-year-old father, who actually is receiving his vaccine in Hawaii and got his first dose this last Tuesday because he had seen John Muir physicians, even he was getting notices because he was in their database. So look to your healthcare provider. They are the ones where you can easily log in, but the county system will also be helpful. We aren't sure yet when we're going to be able to roll into other frontline essential workers, which could be school teachers, grocery store workers, bus drivers, those who can't help but because of their profession come in contact with the general public when that will take place. Congregate care settings with outbreak risks. In some cases, those have already begun, depending upon where the outbreak risk has been. And so those are taking place as needed. So we're hopeful that we will continue to roll this out. The biggest issue is how much vaccine we're going to get. And we generally do not know until a week before the county how much we will get. Now, some larger statewide providers, such as Kaiser, such as Sutter, they get their supplies independently from the state. The county, though, is primarily responsible for smaller providers, and we also are providing vaccines through Safeway, through CVS, through Rite Aid, and so they rely upon us for their vaccine supply as well. But we are the ones who are scheduling at your local Safeway pharmacy or your local Rite Aid pharmacy to receive the vaccinations there. So how do you sign up when it's your phase? And start with your own provider. Again, that's what we're strongly encouraging you to do, but we're not prohibiting you either from signing up at the county site, which is the coronavirus.cchealth.org/get vaccinated. And there you click on a form, and over here there's excuse me, I went too fast. You can click to request, and you essentially, it's almost like you're filling out a Google Doc. You put in your information, your insurance information, your healthcare provider, and then if an appointment is available, you will receive an email. And as I mentioned again, if you're 75 or older, your appointment will be prioritized. It's not always going to be conveniently located, at the local CVS pharmacy or the local Safeway pharmacy. It may be, suggesting you go to Concord or San Pablo or someplace else where we've got a larger scale clinic where we can get you in faster. And we appreciate your patience. We recognize that a lot of people, particularly in the older than 75 phase, are not able to navigate the internet as easily. When my dad needed his vaccine appointment, I was the one who logged into his healthcare provider's MyChart and filled out the form so he could get his first vaccine. So if you have trouble with the internet, we do have a call number. It's 1-833-829-2626. And this is not to ask questions about vaccines. It really is just to schedule appointments. And we encourage people who need to schedule their appointments that way. So this is a great chart that will show you how many vaccines are administered by day. It's updated there's a little lag time, and that's really because you have to manually enter each vaccine as it's given. Somebody's doing that. And so sometimes there's a few days lag. The gray at the end of the chart is the lag time. And so it will probably catch up to the rest of the chart. But as I mentioned, biggest challenge is how much vaccine we're going to get. Yes, we heard the president say he wants, 100 million vaccines out, and we in the county want 1 million vaccines out by the 4th of July. But it really is going to depend upon how quickly we can roll that out. It's been helpful with the Moderna vaccine now being the one lot that was sidelined for a while because of some severe reactions in San Diego. That's now been opened up, and that's helpful because many of our providers have been relying upon some of those doses as well. So vaccinations, as I mentioned, they're taking place all over the county. The blue triangles are some of our higher volume Contra Costa health sites where we are doing it. The big green is high volume non-Contra Costa health sites. And the one you're seeing in San Ramon, I'm pretty sure is the one that has been rolled out by San Ramon Valley Fire, where they have been doing, I think yesterday, Chief Meyer indicated 800 vaccines just yesterday. They are very quick. They've been doing drive-throughs, but again, all of these, you have to have an appointment. In our county, we have felt it's critical that you have an appointment first, rather than just showing up. I saw on the TV news last night, long lines snaking around the Oakland BART station of older infirm people with masks, certainly not 6 feet apart. And we're really trying to avoid that. That's why we are scheduling appointments, getting you in, once you get the vaccine, having you wait 15 minutes just to ensure there is not a reaction. But everyone I know who has had the vaccine has really expressed how painless it is, how important it is. And when you look at this map, a week from now, 2 weeks from now, you're going to see many, many more sites. We are going onto our community college sites besides the county health clinics. And as Ann mentioned, as they get more vaccine, as they have more availability, you're going to see many of our providers doing much more of what I would deem more of a mass vaccination than a smaller scale vaccination. And the smaller triangles that you're seeing are generally our healthcare, pharmacies, in our grocery stores, in our drug stores that are there filling the appointments that we have through our Contra Costa County scheduling system. Now, this is a fun chart. Doses by recipient city of residence. It's not where they got the vaccine, it's where they actually live. And so as you look down there, you can see that in San Ramon, you've got your population of just over 83,000 people. Already 3,800 doses have been administered, and receiving the first dose has been 3,100 people. And that's about 3.8% of your population. Not a lot yet, but as more and more people get populated, that's far fewer people that will likely be transmitting the virus. And I always say my office is always there to serve you. So by all means, reach out to us. We do have our office staffed by phone every single day. And if you don't get my e-blast, I do send out a weekly e-blast. Contact my office, email my office, and we would be very happy to enroll you. And we give updates on what's happening with COVID as well as other important county issues. And that is my presentation, and I will stick around, Steve, if people have questions for me later on.
Great, thank you, Supervisor Andersen. Yes, we do have some questions for you.
Our first question is for Supervisor Andersen. How long does it take after I fill out the county's online vaccine form to receive instructions for scheduling an appointment?
And it's a great question, and it really depends. Last week, we were getting approximately 1,000 requests per hour for vaccinations. And so when those 1,000 come in, they start prioritizing, as I mentioned, 75 and older. So some people might get a response within hours or within the same hour that they submitted it. Someone else, it could be several days. And so we're telling people, just wait a week or so. And if you still don't have a response, then go ahead and contact not the scheduling line, but the general line, and hopefully they will be able to then make sure that your request was received. But they really are just putting them into slots as quickly as slots become available, but again, prioritizing. If you're over 75, it's more likely than not, you're gonna get a response right away. If you're in that 65-year-old and to 74-year-old, it may be a little bit longer, and it just really depends. And they do try, if possible, to give you appointments close to where you live, but that is not always possible. That's just, they more importantly, they want to get you vaccinated somewhere.
Thank you. Next question is for Supervisor Andersen, and this is combining a couple that are similar. I know you showed the chart earlier of the phases and tiers. So we've had a question about when the vaccine will be available to people 50 years and older, and also for anybody under the age of 65, how will they know when they're eligible?
You will hear about it. Yeah, and we don't know. I mean, it really is coming down to how quickly can we get more vaccine, because we're going to get it into arms as quickly as we get it. And that's really going to dictate when we can move on to the next phase. And sort of we describe it sort of like boarding an airplane. Even if you miss your phase, like if you're 75 and we open it up to 50 and older, of course, the 75-year-olds can still get in line. But we hope by later this spring, we hope that in a couple of months, we will be able to do the next phase, which includes the other frontline workers, and then moving into those who perhaps are over the age of 50. But it just depends on the supply, how quickly we can. Way to be notified is you will definitely hear from the county, and that's going to be important. But we are relying so heavily upon our healthcare partners. And most people do have, if they don't even have a primary care physician, they have some affiliation because they've received treatment at, whether it be San Ramon Regional or at John Muir or at Kaiser or a Sutter facility, or Palo Alto or Stanford. Those healthcare providers are doing a great job of providing that information, and they are sending out appointment invitations to people who qualify. And so I would really continue to go to your healthcare provider's website, as well as look at those emails. Don't just send them automatically to your spam folder when they come in from your healthcare provider, and then go to the county website, because we update daily where we are in the process. But I think you'll hear loudly and clearly once we move into the next phase.
Great, thank you. The last question we have is for Supervisor Andersen. Is Contra Costa County planning to open a mass vaccination site?
We already have what I consider mass vaccination sites through our healthcare centers and at some of our community colleges, but they won't be just show up. They will be by appointment. And we are continuing, as I mentioned, looking at even larger venues where we can serve even more, which would include some of our community college campuses and include, potentially other large venues, but we don't have a major stadium or other locations such as that, but we are ready to scale up as soon as we have that vaccine. And for us, it's so critical that we have it throughout the entire county. And we really want to focus too in some of our communities where it's an equity issue, because they are having a disproportionate number of cases based on their population. We want to make sure we get the vaccine in those areas. And so we're being very cognizant of that. And we are planning right now, for example, out at Rossmore, which you don't think of as a disadvantaged community, but they do have obviously a very high population over the age of 75. A week from now, we are supposed to be launching a mass vaccination site there, and it will be through Kaiser and John Muir, who will be running the clinic with the help of the county, but to get that entire senior population vaccinated as quickly as possible. And so you'll continue to see it by region, by demographic. We're really targeting, honing in to ensure that we can really help the most vulnerable first.